Welcome to another episode of your oral health and prevention podcast. Smile is in the air. I'm Celso da Costa, and today with me I have Attila Nazrin.
Hello.
I hope that I pronounce all the names correctly today, so I will try. Based off the discussions of yesterday night, I'm trying. So you are an experienced periodontologist and implantologist specialized in advanced laser technology.
Yes.
Right. And we have also Tarvin Kaur.
Yes.
Yeah, good. This is a highly experienced dentist with over 20 years of practice.
Absolutely right.
And it's amazing because it's the first time that I can talk about dentistry in India.
Right.
And being a Portuguese and having, I grew up with Indian friends. We were talking about this yesterday night because I had like Bollywood on my life too.
Yes.
It's always nice to see what is real and not the stigma that sometimes we have by hearing or by looking
True.
in the videos that everyone is sending. So tell me a little bit more, like how is India in dentistry? Because everything is evolving really fast. You are a big country.
Yes. First of all, I thank you for this great opportunity to be the part
Thank
of
you for coming.
GBD. Yes. So India, yeah, it is a very vast country, and we were talking about the dentistry. We do have so many doctors also. Yes, of course, we have so many doctors, medicals. Yes. Still, we are lacking something. Yes. Maybe GBD can make a huge change.
Prevention is still not maybe
Yes,
the main
prevention.
core in India, right?
Yes.
Okay, so and how you see it, because you have more than 20 years of experience, I'm sure that you already saw an evolution.
Yeah.
Otherwise, we wouldn't been talking about GBT in India.
No, I feel in the last few years the awareness is coming up. I mean, preventive is not one of the topmost priorities with the people back there, but I think because of social media and a lot of dentists coming online now and trying to improve that awareness in public, I think it's making a little change. And GBT is coming at the right time because a lot of new technologies have come in India. I mean, we have the scanners, we have the best of everything equipments, and it's only the awareness that has not come up. So I think in the recent time, thanks to, like I said, social media, we are coming in. So GBT is something that is coming now, and there are people who are getting to know more, and word spreads fast in India. It's the moment they experience it. If they have a positive experience, the word of mouth is the fastest in India to spread. So that way, it really works well. So we are hoping that when we go back, we'll be able to spread it even more further.
Spread
Absolutely.
prevention, to change.
Indian people like to talk, so we pass a good word around very fast.
Good. And
Yeah.
how is the education then in India?
So I am basically from south part of India.
Yeah.
So I am like we do have so many states in India. So I am the most southern Kerala.
Okay.
Okay.
Yeah.
So she's from west.
So I'm from the west. I'm from the Mumbai side.
Mumbai.
So we have cosmopolitan people that side, and I come from a town called Pune, which is very close to Mumbai, and we have people over there who accept if you come forward and you explain to them, they understand and they accept things much faster. Like it's easier to communicate with them.
So it's a country that's open-minded.
Very open-minded.
Yes.
Okay. How is the implementation of new technologies, new protocols in India?
Sorry, I didn't understand that.
How is the implementation of the acceptance of new technology, of new
So a lot of
protocols?
thing depends on the trust. So what happens is once the patient starts coming to a particular doctor, there is a trust build factor with the doctor. So when the doctor is talking about a new technology and explaining how it is better for their health and even making it more conservative or giving better results, the patient has that trust with the doctor and they are ready to accept because it's the doctor whom they trust who is advising them for the same. So I think that trust factor works between a doctor-patient relationship.
So you think that there's still is really cultural, right? We believe what the doctor is saying, so the power is in the side of the doctors to do the change.
It is.
Yes, or
That's it. It is.
Yes,
It is. It is.
And of course, they rely. It relies on the results. When they get nice results, a great results, yes, of course. Like more publicity matters a lot.
So in India, people like to stick with the same kind of practitioner if they've had good
Yes.
experience.
Yeah.
We're not the ones who will look for another practice unless something has gone wrong, because we build that trust factor and that interpersonal relationship with the person, and that works for them. So it's not like there's no insurance in India.
For dentistry.
Everything is
So
private.
everything
Yeah.
is
Everything is
private. So it
private.
really is up to your choice. So once you build up that rapport with somebody, I think it just works. And whereas, because I've lived in the US as well, their patients normally chose their practices according to the insurances that
Yes.
was
Yeah.
acceptable, and it didn't really matter to them which doctor was practicing in that particular practice. Whereas in India, people, if I Dr. Tarvin Kaur owns this practice, my practice name is New Age Dental Care. Nobody comes for New Age Dental Care. People come for Dr. Tarvin Kaur
Yeah.
because they trust her. So, and they believe that she'll do the best for you, and that's how it works.
So there's an extra pressure on the
Yes.
on the
Yes.
clinicians because they
Clinicians.
need to build their reputation
Yes.
somehow.
Yes. A repetition is very important back there, for sure.
Okay, but that's good.
Yeah,
Because
it's very good.
everyone is putting their name on the work that they are doing.
Yes.
And one more thing, what I can say is we do have treatments from government sector, but they don't owe these modern treatment modalities, all these newer technologies. So people have to rely, like they have to come to a private practitioner
To
dental things.
yeah.
Yeah.
We were talking a little bit, and Tarvin, you are more in the aesthetic side, so you use a lot more the advanced technology in the smile design.
Yes.
So how are you including prevention, in this case GPT, on the smile design?
So I've been, I do digital smile designing
Yeah.
for many years now, and doing extensive veneers in the anteriors has always been my forte. And maintaining them was always an issue, because for me to do ultrasonics on them was not possible. And whenever they would come back for their hygiene appointments, I had to be very careful that I would not touch the surface of the restorations. So that was always a challenge. And patients wouldn't really come back for recalls. And they have spent a lot of money on doing those smile makeovers. And it was difficult for me to convince them to come for maintenance, because even it was challenging for me to be able to maintain them. But now I'm so confident with this new GBT system that we have, the technology, that with the airflow, when I'm not even touching the restorations at all, and I'm able to remove the biofilm and maintain those expensive restorations that they have done and invested on. And if they come for a yearly maintenance, those restorations are going to last them much longer than they did previously. Because always a lifespan of the restorations is a question from the student, from the patients.
From the patient side,
They'll always ask me, so how long is this going to last, doctor? So honestly, it will last as long as you maintain them.
Yeah.
And if I can give this GPT technology to them, it makes me more confident to tell them it's going to last you much longer.
So in a way, it's a much needed service in India, because if you are talking that the reputation of the doctor is everything, and you don't maintain the work that you are doing, we're gonna have problems. Having problems, the patient gonna blame you.
Absolutely.
Because they never gonna blame themselves.
And you know, we have so many dentists, they'll just leave you and they'll just hop to another dentist and say, oh, my crown fell off or my veneer fell off and it didn't work. So the blame comes on you.
Yeah. So how you direction the patient to keep the maintenance as priority after a huge work, and you being a periodontologist,
Yes.
this is much necessary.
Yes, so I am associating with some of well-renowned doctors in India. So there's a high-end practice. So of course we do have full mouth rehabilitation cases, full mouth implants, all those things. So after the treatment, it's very important to maintain it. So that job comes to me. Yes, maintenance. That is everything. So even the implants, processes, whatever it is, the maintenance is everything. So I used to talk with the patients more than a hour when they comes like to me. I educate the patients, starting from the basic things, brushing habit, interdentals, cleaning, all those things.
Yeah.
So when we are telling, yeah, some of them are like, yes, interdental cleaning aids and all, we used to prescribe, yes, this is the way. It's very like it's working. Yeah. They are taking it to their practice, they're doing it. We are able to make the maintenance phases is continuing. So
I think the disclosing steps that you have in
that
your
is
GBT is one of the
fabulous.
It's a game changer.
It's really a
Yes,
game
yes,
changer.
yes.
Yeah.
And I mean, when they're able to see the visual nobody can see a biofilm, and they don't believe you when you say we have biofilm.
For sure.
So when you can show them where the biofilm, they start agreeing with everything you because they're visually seeing the biofilm. And that makes a huge step for us. It's easier for us to convince them and convert them.
That's what I say always. Like by using the biofilm disclosure, first of all, you are seeing the biofilm yourself. Second of all, you are using as a communication tool and showing to the patient the areas where the bacteria is active. And on third is like it's not a myth. It's not something that you are inventing in the mouth of the patient. It's really there, and now it's visible.
Yes.
And if it's visible, you can remove it.
Yes.
And if it's still coloration, you haven't removed it 100%.
Yes.
So it's so basic. And it's funny because I was reading a study, and it's like 64-65%, I don't recall, of universities, they are teaching biofilm disclosure. So for me, it's already a mind blowing, like how it's not 100% of the universities that are teaching it, but then only 23 to 26% of the clinicians they use disclosure in the real world.
Yeah. I mean, I've been in 20 years practice. I'll admit I never used a disclosing agent. I mean, I'm using it with yours because it's very easy. It's very practical. It's not messy.
Yeah.
Because the earlier ones were messy.
I agree. The gel, the liquid.
Yes.
Yeah, I agree. We put it everywhere.
And as it is, patients don't like dentists. So when you come back and give them that terrible experience, it's already starting on a wrong note.
Yeah. And now with the pellets, like it's 30 seconds. It's only the places where you want to touch. So it's nicer. It's smooth.
Yes, absolutely.
Well, this podcast is also to break stigmas, right? Yeah. And there's always a stigma. And now that we are talking about India, what comes to the mind of the Western Europe and North America is always this street dentist from India. This video that it was circulated everywhere. I saw it. But the real is that it's really different. We have top of the end practice. I saw the pictures of your practice. It's beautiful, by the way. So how can you cope with this? Because you are traveling around the world and you always need to explain how you are in dentistry in India, what you are doing. So how you cope with this? And please tell the clinicians that will hear us and see us.
Actually, my experience has been that this season, the time when I go back, November, December is the time that a lot of people from the US and NRIs they come to India. And they already start messaging me saying that I have this issue, can I come and see you? And I have patients from the US and UK. Maybe, like I said, it's the repetition. So it's the word of mouth. So I have a lot of people who already know me. So I have a good reputation in my town. So they refer me to their NRI friends. So in fact, I feel really elated when I come to know that a foreign NRI is trusting me for their care. And actually, I have 2 patients who come from Hong Kong. I'm not joking. They come only for their dental care. And I have done probably around 25 crowns in her mouth. And for her husband, another 15. And they would come for visits only for their dental care, just for me.
Yeah.
They came, they stayed in a hotel, they spent the money. And yet, I'm telling you, it will cost them much lesser than it would cost them in Hong Kong. But that was not the point. They just wanted it done well because they had done so much dental care in Hong Kong they were not happy with. So I feel even a place like New York, I've heard somebody had a bad experience. They came to India. So I don't think you can generalize the whole state. But dental care in India, if you go to the right person and you go through reference, you can get the best dental care.
I think that's the point because there's good and bad in every single place. The thing is, like, we always generalize. Yes. And this is where we need to the best compliment is having someone coming from the other way, the other side of the world just to see us.
Yes.
Because they trust. Yes. It's not easy. It's like vulnerable. You are trusting your smile to someone else.
Yeah, it's not easy to let somebody grind your front tooth. You have to have that trust to 100% to let somebody grind your front tooth. So, yeah.
I remember this, like when I was doing my clear aligner treatment.
Yeah.
I just went to my friend because I trusted him and they saw the results, and I don't want anyone else touch my mouth if I don't have a good reference.
See, because dental treatments are cannot be reversed. So that's the problem.
Yeah, and even if we want to reverse it, take a lot of time, and sometimes we cannot.
And it costs a lot of money too. Financial is an issue too.
The thing for me is keep a natural smile always.
Yes.
Yeah, whatever dental treatment, whatever dental visit, it's pain. It's a discomfort.
Yeah.
People never want to experience it for the second time.
Yeah.
The GBT. The
Yeah.
It's the.
I agree with you. You are laying in chair, completely vulnerable. You are just open the mouth. You don't know what's happening in your mouth. So yeah. We need to comfort the patients. We need to have the less invasive as possible. But I really think that you are. I love that you came to Switzerland because it was a way also to be able to talk with you, to understand what's happening in India, how we can cooperate. And like you said, it's maybe the best timing to have GBT in India because we have more and more interest. And since last year, I have a lot of people contacting me from India. True story. True story. From the last 6 months, most of my new followers they are coming from India. Yeah, I did like the number one is USA. The second is from India. So it's crazy. I wasn't expecting that, and this is since we start representing a little bit more GBT there.
It is. I'm telling you, there are, like I said, there are a lot of dentists there, but there are many of them who really want to bring the best technologies in India. So people who are contacting you are for sure going to say that they want GBT because, like I said, social media and word of mouth really works well,
It works,
and it's already doing big.
And they have a lot of questions, but good questions.
Yes. Yes.
Like, do you have a reference for this quote, or you are claiming this?
So we have a big challenge when we go back and we train the other dentists because we'll have to handle all those questions.
Yes.
Yeah,
So
sure.
they need, so they ask, even the patients ask, what's the relevance that this doesn't cause enamel loss? Patients ask.
The patients are asking. Wow.
Patients are asking.
Yeah, I was interviewing some Turkish clinicians, and they were saying the same thing that patients come already with information about air flowing.
Yes.
Air flowing. I was astonished.
It's the Dr. Google talking.
The Dr. Google.
Yes.
And it was exactly that the discussion. And I said, okay, we are in the generation that the patient is the most informed as ever.
Yes.
But our role is not educate the patient anymore, but help them to decide between the good information or adapted information from them and the bad information or not adapted information from them.
Right.
Otherwise, they are looking for dental clinic.
Yes.
I'm repeating the same sentence, and they will end with a cancer diagnosis.
Yes. Yeah. That's the Dr. Google. That's the problem. We need to beat Dr. Google.
You need to beat Dr. Google. It's difficult, but okay, I'm counting on you. At least in India, because you are billions there.
Yeah.
So So Attila, Tarvin, thank you so much. I love this. So I have more insights from India. I hope also that the listeners will have more insights that they look for you. That the reputation is important, not only in India, but I think reputation should be important everywhere. Because every single time that we are touching something in the mouth of the patient is our own name that will be there, and we are helping or scarring something for the rest of life.
Yes.
So thank you so much. I hope
having
that
us.
we will
Thank you
talk
for
a little bit
having
more.
us.
And good luck for India to spread the word of prevention too.
Thank you.
Thank you. So for the listeners, thank you again for watching another episode. So do not forget to subscribe in any platform where you listen to our podcast, Apple Podcasts, Spotify, or YouTube. And do not miss the next episode. Thank you.